Folks, since I know we're running behind waiting for everyone, it occurs to me maybe we go ahead and get started. We can do the introductions though, maybe as we've got folks here. But there are a couple of items that it occurs to me we could just touch on for our new panelists. Donna, I'm thinking particularly Georgene and Joacy. Hopefully I got your name a little bit right.
You did.
Oh, good. It's phonetically accurate, so it's a little easier once you said it. I was like, oh, the A is actually pronounced.
Yeah.
Yeah, welcome. Really glad you could be with us. And I think whatever we're all experiencing here, it'll be fine. I did want to maybe just touch on where we've been and the dialogue that's taken place so far. And I was looking at the synthesis of prior conversations, and it might be a good place to begin. And so maybe just touching on the community issues first. And then Donna, since you're the other one that has been with us this whole time, it'll be good to get your perspective as well. But I think what we articulated is patient voice and empowerment. Really important that patients tell their story and bring their voice forward. And so how to support them in that, including, just the vulnerability of doing that. It's uncomfortable to live that, in some cases, trauma repeatedly. Both the going through it and then the sharing the story has its own sort of re-traumatization aspect to it. The other big issue was around patient education, and that comes in the form of both advocacy as well as just knowledge about how to navigate the system. Classic dialogue around inclusion, the no decisions about me, without me kind of dialogue. A lot of provider education, provider empathy training, making sure that the issue is and folks become knowledgeable at the provider, the nursing, sort of all the folks that are in the ecosystem that routinely don't get sufficient training. A lot of discussion about how this is not even an hour of coverage in all of medical training. Also, thinking about the communication gaps between patients and providers. I'm just sort of listing the panoply of areas that we've covered so far. Also how to find out about, treatments and good physicians and good care providers, recognizing there's insufficient care providers that came up. All the issues around employment and having extended leave for medical grounds, since many folks who are suffering are struggling to operate with very limited sick time. Making sure policymakers and policies address this important issue, and then kind of the impact of the disease as it relates to insurance and disability coverage. So those are, I think, some of the big themes that have sifted out of prior discussion. Donna, I'd love for you to also weigh in, given all your work as well.
Sure, absolutely. And, obviously you're covering a very wide spectrum of issues that, that's why we're here to speak about some of these. A few things that weren't mentioned that did come up last week in the session that I attended was we talked a little bit about transition, right, from pediatric to adult and the gap in care. That a lot of people experience. We had talked about, issues with employment because of the lack of awareness and sometimes the lack of kind of proactive support that the physicians can offer. But the same thing applies to school, right? When a child is in and out of school with sickle cell crisis, it's very hard sometimes to, keep up that communication over the years. Is this a child that's just avoiding school, or is there something more? So I think that's another big area. And the kind of the third thing, as we know, there's a lot of disparities that can impact your ability to get care, and geography does play a big role. So part of what my hope for this room was to learn a little bit more, what areas do have, decent or even good support for the sickle cell community versus others that don't. And last week we talked about how the state of Maryland was able to get coverage for some of the supplements. As we all know, that can get very expensive and can add to the financial burden, and yet it is can be directly tied to, better health. So I think those were kind of just the three areas, if I was to add anything, that I would add kind of into everybody's toolbox there to think about as we kind of guide the discussion today.
Absolutely. Thank you very much for those additions, and I appreciate you catching me up on some of the dialogue that occurred during the session I did not attend. Also, one other thing just to surface is as we think about building the stakeholder community and the types of people that need to be in these dialogues, we talked about, we need the health provider community, the hematologist, the care team of nurses, pain management, the medical professionals, the leaders who make decisions about protocols. And, I know that there was a request to have specifically, some of the transplant doctors, for example, bone marrow transplant that was recommended by Brianna, one of the other participants. And there was a specific request, I think, for a transplant doctor, Maxwell Krem. So that was another, sort of that whole group of providers. And then there was a request to have the treatment actors, that are working in developing the next tier of treatment, the CRISPR technology and, what Vertex is doing. And then there's some others like XCell, just to look to the future and what's in development and where are their needs. Also looking at, disease-specific researchers, folks from academia that can talk about what protocols are working best for certain types of people. Obviously, all the disease associations that are engaged in this fight, the patients, the patient advocates, the warriors, and diagnosis testing organizations, insurance, health plans, funders, both public and philanthropic funders that could advance the funding in this area, policymakers, HR lawyers, health education organizations, actually medical school, faculty, and, sort of folks that are setting curricula, and then social workers. So those are other types of people that we're working to have be in this space with us. And so I know we're in the the summer portion of this journey, and I think we've got sort of less of us here today than perhaps we thought were RSVP'd, but nevertheless, I think we might as well dig in and get perspective from Georgene and Joacy, and I think I see Sandra, you're with us. Welcome. I might ask, just since we're such a small group, instead of being super formal, Lauren, bear with me here, I'm kind of ad-libbing this. If we get a much larger group, we'll go ahead and do introductions along the way, but it would be great to maybe just have Georgene and Joacy say hello, and then just go around the room and share a little bit about your background, and I'd love to turn it over to you guys for some just introductions. So Donna, can I ask you to start just to share a little bit about your organization, your journey, and what has you be here in this room?
Sure, absolutely. First of all, I agree with you. It's the middle of summer, and I'm so grateful to anyone that's here today. I do think that what we're doing here is so important, and we have so much potential. The reason I'm here is I'm a 12-year patient advocate for kids living with complex and chronic pain conditions, and that's kind of where I started looking at some of the bias and access to care issues that kids face and families and people face just because of the bias around the idea of pain. From there, I started working with a group in New Jersey, which is really truly where my heart and my hope and my excitement lies today in particular, because we've been doing some really great work working with medical students and also patients to talk about sickle cell disease. Pathways to Trust has founded a program called It's Time to Listen to Sickle Cell, and we go into medical schools and hospitals and teach about the very real life experiences and problems that patients have trying to access care. We do it in a way that's very easy to absorb. It's a no blame type of thing, but we focus on kind of the communication and some of the challenges that physicians and especially medical students might not be aware or even think about. So, when your patient comes in very stressed out, what did it take to get them into that appointment? And we really try to kind of open the eyes, and we talk very, very directly about, profiling and bias and racism and all the other unfortunate things that sometimes can have a care provider not necessarily be as open-minded when the patient comes into the room, and they might look at them as drug seeking. So, we do this using actors, we do this using physicians, and we also have patients that speak. And, if anyone's ever interested in working with us, we're always open to it. But, overall, I think we are making some very slow progress, but man, do we have a long way to go. So, again, I'm kind of pediatric pain, and then also on the education side through Pathways to Trust. Thank you.
Thank you so much, Donna. Such important work. Um, Joacy, may I turn the mic to you? I'd love to have you introduce yourself and also what has you be here with us. The mic's yours.
Absolutely. Hi, everyone. My name is Joacy Mathias. I am an epidemiologist. I did my PhD in epidemiology, and I'm currently a postdoctoral trainee at Duke University in the School of Medicine. And my expertise is in analyzing big data. So I do a lot of research with claims data, EHR data to ask and answer important health equity questions. So the reason why I'm here is because when I was doing my dissertation, I had the opportunity to study sickle cell disease epidemiology a little bit. So my dissertation was set out to understand what is the prevalence of prescription for hydroxyurea when sickle cell disease patients were transitioning from pediatric care to adult care. So that got me very interested, and then I started wanting to study a little bit more about social determinants of health. That's what my training is currently. And the reason I'm here is because I want to connect with people who are working in this area, and I would like to learn what's going on, and also in any way I can contribute to whatever I could possibly do for this area.
Thank you so much, Joacy. Really nice to have you. Appreciate and really looking forward to digging into what your research is telling us. Georgene, I'd love to turn the mic over to you for your introductions and what has you be with us. The mic's yours.
Sure. Hi, everyone. I'm Georgene Glass. I am the founder and executive director of Dreamsickle Kids Foundation, which is the first sickle cell organization here in Nevada. I am the mother of a 7-year-old child with sickle cell disease. I have been advocating for people with sickle cell for, I would say, 7 years, ever since I gave birth to my daughter. In 2018, I founded Dreamsickle Kids Foundation, and since then we have been been making sure that in Nevada there is increased awareness and education and support for the sickle cell community here. It's not quite as large as compared to other states with where sickle cell is prevalent. However, we have made some great progress here. Um, the biggest being that we have a sickle cell bill here in the state of Nevada, and as I believe someone else had mentioned, I can't remember her name, but our sickle cell bill here in Nevada also requires that Medicaid cover supplements that are prescribed for patients with sickle cell. It also requires that Medicaid cover any new medication that comes to market for sickle cell if prescribed to the patient. It also established a sickle cell disease registry so that Nevada can get an accurate count of how many people in the state has sickle cell, because our estimate is from the CDC in 2007. So 15 years, we don't know exactly as of today how many people in Nevada have sickle cell disease. We do a lot of education and outreach and community support. I'm a community health worker, so I speak with parents and patients that are impacted by sickle cell and just provide them our community support, because before 2018 there wasn't much going on in support or even understanding of sickle cell. We started a program last year called the Nevada Sickle Cell Disease College Tour, where we are going to different colleges and universities to discuss sickle cell from the medical perspective as well as the community perspective. So myself and my daughter's hematologist, along with a actual sickle cell patient, we go and talk to college students, medical students, and public health students about sickle cell disease and its impacts in the community and some of the best practices when treating sickle cell patients. We facilitated a class at UNLV for the second year medical students. It was about 60 medical students, and they were really engaged and impressed with the class, and they felt that they learned a lot, especially when we had our patient advocate speak on her experience as an adult and even her experience transitioning from pediatric. Oh, sorry, I think I went out. But so yeah, that's just me in a nutshell.
Thank you so much. Really appreciate you being with us. And it sounds like there's a lot that is occurring. And I'm curious on the bill. What's the state of that legislation in Nevada? Is that looking good, or where is that in the development?
So it passed in 2019. So we've
it
had
did.
a
Okay,
bill
so
in
it's
the
already
state
done.
since 2019. So it's completely done. We weren't able to fully get everyone on board, and there's still a lot of people who don't have a clear understanding because the bill passed in June of 2019, and of course the pandemic started, January, February of 2020. So
Yep.
our organization was actually awarded a grant from Global Genes, the Rare Financial
Yep.
Advocacy grant, and we are creating an ebook to explain the sickle cell bill and how it benefits the patients, and also what the requirements of that legislation are for medical providers and insurers here in Nevada.
That's fantastic. Well, that's great news that it's passed, and I'm wondering if others know, and we'll come back to this in a second. Actually, I'll pause. I see Renisha, and by the way, George, I said it exactly the wrong way, but can you tell me the pronunciation of your name again?
Sure, it's Georgene.
Georgene. Okay,
Yeah,
thank
so
you.
Georgia, then Nay.
Nay, it's beautiful.
Thank
You.
you.
It's a new one for me, but I love it. And so if Renisha, did I do justice to your name, or if not, I apologize, and you can correct me. I'd love to turn the mic over to you to share a little bit about your background and also what has you be with us.
No, you said my name Perfect, Ranisha. I'm so glad to be with you guys this evening. Wasn't expecting to, but glad I can be. I heard Donna's introduction, so I come in the same spirit of her, except that I am a sickle cell patient by birth and destiny. A social worker and a researcher by trade. Um, I've been dealing with sickle cell disease since birth. And what I do professionally is just bridging the gap between the community and the medical community, so that we can really improve quality of life and quality of care and accessibility, and really understand that patients' voices and what they contribute is what's most important. And I see that our topic today, even though everyone's just giving introductions, equity, but I would just say that I offer diverse experience, contributing to equity in my background, and really just elevating that hearing patients and really understanding what the experiences are of living with sickle cell disease and what it is to navigating care, what stigma looks like, what implicit bias causes us to experience, is really how we combat equity, and really what I do in my everyday work, with working with sickle cell disease patients and in the medical community. I primarily work with hospitals to help train medical professionals, similar to what Donna expressed, through theater pedagogy, to help them to understand what scenarios based on patient experiences are like, and how interprofessional teams, everyone that is involved in caring a patient, from the pharmacist on down to the administrator, plays a vital role in ensuring that patients have great quality experience and really do not experience in what we go through every day in emergency departments, and not more our diseases enough trauma, and that the medical system doesn't have to be more traumatizing. So just working, I'm here today because I just wanted to hear the perspectives and join my colleagues as we talk about how to destigmatize our medical system, and really just joining together with community, because this is really what it takes to really make sickle cell more equitable.
And Renisha, I want to thank you so much for jumping on, because I know that you had a little bit of a conflict today, but she's actually being very, very modest. She is also the bloodline for Pathways. She does a phenomenal job reaching out and helping to talk about some of the more important things that can be a little bit difficult sometimes within an organization. So, Renisha, again, I just want to thank you and let everyone know how great you really are.
Thank you so much, Donna, and thanks, Renisha, for being with us. And this is just an open invitation for anybody in the audience who feels like they want to participate. Please feel free to raise your digital hand, and we'll invite you to the stage. Okay, so I know one of the things that we talked about in the past is, how do we get from the, very challenged as is state to the state that, that does really promote equity, to the vision that many of us have. And I know, education, policy, but I want to just sort of dig into these topics a bit, and and recognize that part of it is about getting the right stakeholders to be here and be contemplating this issue with us, yet at the same time sort of preparing for what's needed. I just want to open the mic up, generally, what's the most critical set of things that we can be doing as, as we're convening this multi-stakeholder group. And really, I consider today more of a planning session, since we're in the throes of summer. But I'll open the mic up here. Anybody flash their mic? If otherwise, I might call on you to dig a little deeper. Okay, I'm going once. You guys want me to call on you? Okay. Joacy, I'd love to turn it to you. You've been in the heart of research, looking at equity, looking at big data. What do we know? What are we learning? What do we not know? What's the state from your perch?
So from what I'm seeing, like what everybody's been, like how you've been talking about, there is importance, there must be a lot more importance given to education. But I also want to talk a little bit more about the funding issue, maybe as from a researcher perspective, I can tell you that we need funding to do research work in sickle cell disease, and this needs to be incentivized, um, because I feel like in a lot of ways, cancer or cystic fibrosis is a lot more funded. It's a lot more popular among researchers because of better pay lines, because there's a lot more opportunities available. There's a lot of interest going in that direction. But when it comes to sickle cell disease, I feel like the funding is really meager. And especially for a researcher who's an immigrant, it's even harder. So definitely need funding to do research work. And I'm saying this because, like how Georgene was pointing out, um, the prevalence of sickle cell disease, it's those kind of updates, like the basic updates themselves, they are 15 to 20 years old. The prevalence of sickle cell disease in the US, as we quote, it's 100,000, is again 2 decades old. So we really don't know even the basics that need to be updated. And I feel like having funding and having the ability to do surveillance and research and come up with study designs to get to know these folks more would really, really help in, first of all, understanding who is being affected, how many people are being affected currently, and also it could be one of the first steps to moving towards health equity, in my opinion.
Joacy, can you say more about, so let's just imagine that there was funding for surveillance and for particular studies. Um, Sort of thinking about it from the context of what's the additionality? What gets better for patients, do you think, in earnest, if that, and I'd love for you to even, mention a few studies that you think, you would want to have happen. And the reason I'm saying that is even though, we don't have all the folks that we had expected to have today, we do have a series of funders, and these are recorded sessions, and we can take snippets and literally pass it right back into the equity. There's a whole concert, and Donna, because you were there at Grantmakers in Health, right? I mean, funders are talking about health equity and and trying to fund solutions. So Joacy, I don't mean to put you on the spot, but if you're willing to play along, I'd love to know what would you like to study right now?
So I am currently in the OBGYN department at Duke University. So I can tell you when it comes to sickle cell disease, just understanding the perinatal epi of sickle cell disease is really lacking, particularly today, because now we're moving from a pediatric population to an adult population. While there is some considerable amount of studies that's been done on the pediatric population, but when it comes to the reproductive choices, reproductive health, gynecological health, just benign gynecological health conditions, these are not as much studied. And would be one thing I am particularly interested in, given that another thing that I would be very interested in would be the introduction of these new disease modifying therapies like voxelotor and crizanlizumab. In addition to hydroxyurea, hydroxyurea is contraindicated for use during pregnancy. But what about these other medications? Can they be used during pregnancy? How do they help with pregnancy-related complications? And uh, where exactly can we start this kind of education, talking to folks about what you can do, what you cannot do, uh, would be really, really helpful, I feel, for helping the field progress and meeting patients where they are and just trying to understand what they need and how, as a researcher, I could contribute to understanding things better.
I'm trying to find my mute button.
Yeah, sorry. I just did the same thing. Can I ask a
Yes, go
question?
for it.
And I'm not sure if this is the appropriate place to kind of insert it, but has this room talked about the STAT Act that has been introduced into Congress? I have gotten some information on it, and I know that it's focused on accelerating treatment and cures for all sorts of rare diseases. Um, but
We
I
have
don't know from a
we have
research
not.
standpoint. Okay.
Yeah, we have not talked about it, but I think it is absolutely appropriate.
Yeah,
I'd
because
love
I'm
to hear
thinking
about it.
it might be very interesting if we could get someone from like RDLA or Every Life even to come in and talk a little bit about kind of the work that they're doing. I can share a little bit about it because I know that it's trying to look for kind of policy reforms at the FTA because they're trying to accelerate the development of different therapies. And I guess, several politicians have introduced the bill. Senator Klobuchar, I know, was one of the original authors. I'm trying to think of the others. There was at least two or three others. Wicker, I think, was one. And it's co-sponsored in the House and in the Senate. So I wonder if, like, we talk about when we have this room and we bring together stakeholders, maybe there is some type of agenda or information that if we can all kind of take a look at and bring it back to our networks, perhaps that's a way to kind of mobilize, the need for action, for more money, for more research, for sickle cell. Here, I'll put something in the chat. I'm in the car, but I'm gonna pull over.
Okay, yes, definitely be safe. Donna, I appreciate you bringing that forward, and advocacy around policy is incredibly vital, as I think Georgene was speaking to, sort of the that issue as well. I think I saw Renisha and maybe Joacy flash their mic. I just want to make sure I'm following along. Apologies, folks. There we go,
I
Renisha.
did, but I do want to let Josie finish with her thought as she presents some good research for pharmacological methods. So I
Great,
will allow you.
Joacy. Yeah, thank you
Sorry,
so much, Renisha.
thanks, Ranisha. Sorry, I'm just figuring out. This is my first time on Clubhouse, and this topic really excites me, so my hands are all over. No, I'm actually I've completed my thought, and I could definitely make a list of all the studies that could really help. Even when it comes, because of how sickle cell disease can complicate pregnancy and pregnancy outcome. Um, there is also this issue, this entire thing about the mental health for these patients after postpartum, particularly, that is not studied at all. So that could be also another interesting thing to consider and study. And that's all. I think I'll stop there.
Joacy, I appreciate that, and I'm sure that we would love to have you put together the research that you think is most pressing, and absolutely, this is a great forum for that. I want to introduce Gregory. Gregory, thank you for joining us, and I want to give you an opportunity to share a little bit about your background. And you're joining the conversation as we've been um, at least touching on the treetops of the core issues, everything from a little bit of a review of what we talked about in prior conversations, as well as some new important pieces that, sort of broadly speaking, I think we heard from Joacy talking about, just the incredible lack of funding and lack of incentives to study this disease, specifically, thinking about some of the other incentives for, things like cancer and other where there's better pay lines, lots of, interest moving in that direction and, sort of, getting equity established here in the form of additional funding. We also talked a little bit about the um, some of the advocacy that's underway. Georgene was sharing a recent bill in Nevada that passed in 2019, and some of the work that her organization is doing. I'll let that kind of come to the fore, but you're finding us sort of as we're in the conversation. But Gregory, without further ado, I'm going to turn the mic over to you for your introduction. The mic's yours.
Thank you very much. So my name is Greg Kato. I'm a hematologist and researcher in the field of hematology for almost 30 years now, having worked and done research in hematology, especially sickle cell disease at Johns Hopkins Hospital, the National Institutes of Health, and the University of Pittsburgh. For the last couple of years, I've been at a company called CSL Behring, where I'm directing sickle cell drug development in that company. I might mention, maybe relevant to some of the issue that we were just raising, I've also become a representative from my company to the Sickle Cell Disease Partnership, which is a multi-sector health policy advocacy group, working with the Levitt Group, a lobbying agency started by former HHS Secretary Michael Levitt, that's lobbying for federal legislation and executive administrative action to improve access to care for patients with sickle cell disease.
Thanks so much, Gregory. And maybe I'll put you on the spot to begin here is sort of what's exciting from your perspective and the framework of research, new therapies coming down the pike. Just what's the view from the development corridor?
Well, I have to say, over the 30-year span that I've been involved in the care of patients with sickle cell disease, there's never been a better, brighter, and more exciting time for therapeutics development. When I first started as a full-time hematology physician in 1991, there were no pharmaceutical companies that were interested in sickle cell disease. There were some efforts funded by the National Institutes of Health to develop new treatments. But I have to tell you that federal funds actually come nowhere close to providing the amount of capital that's necessary for drug development, and really only private companies can come up with the kind of funding that's needed for these kinds of things. Large for-profit drug companies, they actually have often 10 times or 20 times as much to invest as the National Institutes of Health has for particular disease entities. But there were no pharmaceutical companies that were interested in sickle cell disease at that time. The first drug approved for sickle cell disease, hydroxyurea, was approved around 1995 as a result of co-funding by the NIH and by an industry partner, but mainly the NIH. And then every drug approved since then, which are the three main additional prophylactic drugs, they've been completely funded through industry funding. And besides that, there are 20 or 30 more clinical trials going on with brand new agents, and another 20 or 30 with different forms of potentially curative therapy with stem cell transplants and forms of gene therapy. And just as I left my role as an academic clinician researcher at the University of Pittsburgh, I couldn't keep up with all the phone calls from different drug companies that were calling to ask me for advice or ask me to participate as a site in leading a clinical trial. There is a huge industry interest now in developing drugs for sickle cell disease. And this actually has been going on for about 15 years, but it does take about an average of 17 to 18 years for any single drug that gets a head start in the laboratory to get to the point of clinical trials and FDA approval. And so all of these drugs that have begun to surface and that people hear about, they've actually been getting incubated in these companies for usually 10 years or more. And so to me, the exciting aspect of sickle cell disease is all of the new ideas, all of the new money that's being invested in developing new potential treatments, and that run the gamut from potentially curative therapies to treatments that are trying to be so good that people don't even want to or need to take a risk on some of the risks that are inherent to potentially curative therapies. And so this landscape is incredibly exciting to me.
Thank you so much, Gregory. Really great to hear that perspective. And I think it's particularly useful when we think about, that so much of this ends up being incubated for so long that it's often difficult to see the results. Renisha, I know that you were patiently giving Joacy the mic, and then Gregory joined us. So I want to come back to you. I know you had some comments to add to the discussion. The mic is yours.
Oh, thank you. I was just going to you had asked Josie a question about research, and I wanted to, you said something about hearing like different funders being connected, and I wanted to, from a patient perspective, I wanted to kind of shift us to think about, other things that are needed in research. And so for me, I would say just living with the disease as well as being a researcher. When we think about health equity and what it is, helping someone to reach their full health potential, I think that research that really focuses on helping patients reach those social determinants, address those social determinants of health, is really what's vital and really something that's very important for right now. I think when we think about sickle cell disease, it's a lot of research, which is very important, is being done on curative therapies and medicines that may work and treat the disease, and so many disparities, and there's no reason why we should have such limited medications that are on the market to treat the disease. However, it's so much, I see every day, kind of, if we think of like, if we just take our mind and focus of like self-fulfilling prophecy, patients are literally cured and really don't understand what life is after sickle cell disease, just because imagine your life with a disability your whole life and not being able to work, not being able to have employment, not having a stable environment, not having good interpersonal relationships. And so I really promote and encourage researchers and community-based organizations that are really going to help and really fight and really support patients and really normalizing and living with their disease and understanding how to maximize their life with what they currently have, and really understanding what their experiences are, and really helping them to find suitable and equitable employment, suitable and equitable housing, because those are really the things that are really impacting our illness. Like I can get a new medication, but I don't have a sound place to lay my head at night. I don't, I can't, I'm missing my appointments, those things that we don't take into account. I'm missing my appointments because the employer does not give adequate PTO. The employer doesn't care that the clinic only opens Monday through Friday. The employer doesn't care that, emergency departments take all day to really treat my pain, or I'm not able to go to work under the influence of my opioid treatments. And so those things that we just don't think about are really things that are similar to what Josie said in prenatal care, are those mental health things that are really weighing patients down. And so if I was really wanted to just speak to that, of what we really need to, what really matters, what really needs to be funded. We really need to help people have equitable lives by really pouring into the quality of their lives.
Thank you, Renisha, for sharing that important perspective. Definitely important. Donna, I see you have something you want to say, and then I think I saw Joacy also flash her mic. So Donna.
I was just going to add, if that's okay, one of the things. So I think, Renisha, you are raising obviously the most important part, right? The human factor in all of this. And to double back to what Gregory was talking about, I think these pharma companies, because they are in a position, and I was just actually at a pharma conference, and the big buzzword is DEI, and let's talk about patient voice, and I think that's all really positive and it's going in the right direction, but it definitely does not go far enough. And it would be wonderful if you could see pharmaceutical companies with these big budgets looking at support, looking at the mental health needs of a patient when they are thinking about, should I or should I not get pregnant, pre-pregnancy, or thinking about, I do want to try one of these trials, and how can this help my life, as well as the activities of daily living that Ronisha was just talking about, that really truly do create a lot of the obstacles and the reality of what these patients face. So we're looking for money obviously for research, but I also think the patient support that pharma provides could also go a lot further. And just wanted to weigh in. And if anyone has seen programs that they think are done particularly well, I'm always on the lookout for them. So that's all I wanted to add.
So I think it's great for pharmaceutical companies to help where they can in areas that are outside of pharmaceutics, but obviously this is also beyond um, their ability, their remit, and even their finance, because the costs of healthcare and of health equity in terms of other sorts of social support, housing, um, and and food and just infrastructure support. This is even beyond the budget of the NIH, and in fact, the NIH budget is much smaller than the general health and human services budget for Medicare and or CMS. Um, and in fact, those are the agencies that do have the funding, the infrastructure to provide health-related services and more service support, and other agencies that give other kinds of support, like housing support, which is a social determinant of health that's extremely important, and housing security and food security, without a doubt, play a role in the severity of sickle cell disease. But I think where we should direct our energies is for those agencies that are appropriate to deal with these issues to kind of step up to the plate and consider that sickle cell disease is a significant issue on their plate. And I mentioned that's the kind of thing actually that the Sickle Cell Disease Partnership is aiming to do, to get more parity and access um, to care and services like other disease groups have been mentioned. And there's no reason we shouldn't be expecting um, government agencies that do give good support to cancer patients, for example, to give equitable support to people with sickle cell disease.
Yeah, I mean, you're really speaking to sort of a fair allocation of, for folks living with different kinds of burdens, and appreciate that perspective. And then I also think that, for health philanthropy, and I'm talking about, sort of the big health philanthropy, this is also another area where, thinking about um, and we think about different diseases as well, and it's really, could we establish a more fair structure to think about burden and also allocation of resources to meet that burden? And nowhere is that really. I'm curious if anyone's seeing any real movement in that direction. It seems as though we still, kind of do the dance of getting, folks interested in one disease at a time, but really we need a portfolio approach, right? Because that would address some of the disproportionality issues. I'm putting this out, and it sounds like a statement, but it's really a question. So I'll invite banter on this. Is that a pathway that we should be thinking about, and recognizing also, one other thing that I know some states, including California, with the CalAIM initiative, are really speaking and putting money behind the social determinants of health in the form of, paying for things like housing and food, and, really trying to dig in a different way, deeper into those social determinants of health. I'd love to open it up. I know I've thrown a bunch of stuff on the floor, so apologies for that, but pick which part you want to talk about. And Georgene, I know we haven't heard from you yet on some of these issues, and Joacy, I want to give you an opportunity as well. Georgene, do you want to go first? Okay, I'm guessing you're looking for your mic. Joacy, do you want to maybe jump in while Georgene is finding her mic?
Sorry, I've been having a little bit of connection issues, Elizabeth. So, from what I could hear, the question was, there seems to be like focus on just one disease that is being supported at a time, but we should start moving to getting more support for other diseases as well, like sickle cell disease. Is that the question? Sorry, can you say the
Yeah,
question again?
I'm wondering whether there's been, dialogue around a portfolio-based approach, right? If we think about our public purse, our public dollars, ought they to be thinking about distributing resources in more of a, burden type, by disease, by population, right? So that there is equity versus this sort of, try to get, pieces of the purse from time to time with bills versus, having it be more systemically baked into budgets. That's what I've got on the floor for contemplation anyway.
So my perspective is, so far I haven't seen equity in terms of funding, because if truly there were equity and it were based of population or the prevalence of the disease, sickle cell disease would have more funding than cystic fibrosis, which has, I believe, 1/3 of the prevalence of sickle cell disease. And also, they have more medications than what we have. We have, like, I believe, 4 to 6 disease modifying therapies, whereas cystic fibrosis has up to 20. So, in terms of that, I don't think there is equity in terms of funding. And I also think it is in the way of raising awareness, like how when Janisha was talking about from the perspective like humanizing the disease, I was thinking there's so much that, even though I've been in this field for like 3 years now, I don't know. There's so much I don't know from the patient perspective. So there's so much awareness that needs to come in, and that could possibly encourage more funding.
I appreciate that. Donna, Georgene, Renisha, anybody want to jump in on this inquiry, or Gregory?
I agree that the disparity in funding is very great when it comes to sickle cell disease. Being a community-based organization that does a lot of direct support and advocacy for the sickle cell community. Many sickle cell organizations do a lot for the community with very little, and it seems like it's hard to figure out what we would need to do in order to be to receive more funding. We can't, it's not that there's no way for me to believe that all sickle cell organizations just don't know how to prepare and propose a grant to write a winning grant to get these type of awards. I just don't believe that the funding is there. I noticed in like 2019, just looking through like the federal like funding opportunities that there was only two funding opportunities that directly were specifically for sickle cell, compares to hundreds of thousands in other sectors and everything else, health related or otherwise. And I just don't think that that should be.
Thanks, Georgene. Joacy, I see you, and then Christina, we'll come to you in just a couple minutes. Joacy, the mic's yours.
Thank you. I appreciate Georgene's insight in there. So one thing I was thinking about in terms of getting more getting more people to just at least have an awareness of sickle cell disease is, even when we look at the movies, right? When we watch movies and when they're talking about disease that is debilitating, it's usually cancer or sometimes even cystic fibrosis. But not having a representation of these like particularly sickle cell disease, um, is something that I have not been comfortable with. And I feel like having a representation in like movies or to just sincerely spark up more conversation about the topic and probably encourage more buzz and awareness about sickle cell disease, and maybe, just fingers crossed, maybe even help with funding or raising funds.
Um, I oh, I just wanted to jump in there with that. As far as like creating a buzz, that's been done many times by many people, but for whatever reason, that buzz lasts as long as, say, Sickle Cell Awareness Month. After that, um, those people that can make those buzzes, they are not talking about sickle cell anymore, as compared to other disease states like ALS, cancer. That's 365 days a year. If somebody is creating a buzz and showing support because they have a large platform, they're doing that all year. But when it comes to sickle cell, a lot of those individuals that or organizations or people who have the platform and create the buzz, it just seems like after the campaign is done, then nobody says anything else about sickle cell after the campaign ends. And I'm not really sure of how we should go about changing that.
Can I jump in for a minute? Because I have a daughter who's literally getting her master's in screenwriting, because that is her dream, is to actually create some kind of program that's more, that's more applicable to what we call kind of unpredictable chronic illness, right? I think the world understands what happens when you get sick, you get better, or you go get sick and you don't get better. But it's the in and out, the off and on, um, that really would lump sickle cell in with many other conditions. And I don't mean to be negative, but I feel like everything in this world sadly comes down to money. And if you could somehow quantify, this is the number of people on disability, this is the number of jobs that you can't fill because people can't work because they don't have the support. I mean, I hate to say it, but I think if you could tie the loss of in financial dollars, maybe that would get attention. I don't know, but I agree with you. I remember when the Red Band Society came out. I don't know if anyone had ever seen that show. It was probably about 6 or 7 years ago, and it was just so unrealistic, and it was such a disappointment. But I would love to see like a sickle cell character on the main screen. I think it would at least help a little bit. Storytelling, I think, works.
Absolutely. Gregory, but I want to just give Christina an opportunity to say a few words, and then Gregory, I'll come back to you. Christina, I'm going to turn the mic over to you. Welcome.
Hi, thank you for allowing me to come up and just say a couple of things. Sorry, I have been on the call since the beginning, and I'm so excited to have been able to have the chance to hear some of the conversation that's been going on.
but I also am a mom of 6, and the littles were getting ready for bed, so there's no way I could have spoken while they were around, just out of courtesy for all of you and your ears. So I'm
We
Christina Reed.
understand.
I am Christina Reed. I am the executive director for Virginia Sickle Cell Network, which recently rebranded into Virginia Sickle Cell Network. We were formerly Two Terra Girls Inc. Two Terra Girls are the last name of my daughters, Olivia and Morgan Terra, who were both diagnosed with sickle cell at birth. So I have been the mother, the caregiver of amazing girls. My introduction into motherhood at 25 was a single mom. With daughters who were born with sickle cell disease 17 years ago. So every one of you has brought up some amazing points that I relate with and has struck chords with me. One of them being, I think Gregory mentioned that there's been so much progress, and he was talking a little bit and touching a little bit on like big pharma, private companies, NIH. And one of the things that I wanted to touch on was 17 years ago, around the time when I was pregnant, and I've always known I had trait, and that was it. So one of the conversations that is happening now about sickle cell. I'm hearing more and more about it mainstream. Clubhouse, social media is coming out, and it is a stark difference from when I had Olivia 17 years ago. And I was so desperate to hear from someone who has, a child who was in my shoes and could tell me, hey, this is going to be okay, and this is how it may look for you. So I'm excited for the direction in which it's going. Yes, we have a very long way to go, especially to reach or touch cystic fibrosis. That's one of our biggest conversations that we usually have in the sickle cell community. But I think like we're going toward the right direction. Um, Also, of course, Georgene does amazing things with the organization, and we do a lot of similar things. She, of course, has more funding than we do, and I've been trying to give you a call, Gurley, to have you help me through some
Call
things.
me.
Yeah, but right now, the direction in which our organization is going is a network. And what we do is a community of individuals with sickle cell, caregivers, healthcare providers, educators, employers, human service agencies to provide. To all together, we promote sustainable whole person health for individuals and families of those diagnosed with sickle cell, facilitate access to care to those who are underinsured, non-established, or displaced individuals. One of the issues we have where we are in Virginia, we're close to Virginia Beach area, is access to care. And I'm right now in the process of working with one of our larger hospitals here to get data to see some an issue we have is few interested hematologists who are willing to treat patients with sickle cell disease. And then, obviously we have the insurance component where you have private insurance, private providers who only accept private insurance, and our warriors who do not have insurance or are not insured privately. They have state insurance. So that's an issue. And what they're doing is going 2 hours um, west to Richmond, Virginia to get care, which is unfathomable. I cannot believe that someone is in pain or in a crisis or, maybe having complications. Sickle cell is it it's so broad. It's so anything can be going on, and you're having to also figure out transportation to drive to commute 2 hours plus to be able to seek care. So another thing we do is connect patients and caregivers to community resources that mitigate known social determinants of health. Everyone knows what those are in this call. And finally, our hope is to cultivate a new future for healthcare providers, educators, employers, everyone who kind of comes into contact with someone who is diagnosed with sickle cell and their loved ones, just to be aware and compassionate, just for optimal health outcomes. Because I see it, my daughters are very, very good in school, but sometimes they miss school very often. And some very insensitive things are said. So one of the things we do is we have support groups and we just kind of get together. But I know that, let me go back. I'm sorry, I'm talking a lot, but I wanted to get her name. Ranisha was talking about kind of supporting the patient, especially when we're looking at bigger, well-funded agencies, and we're pushing drug development and therapies, curative or treatment. And one of the things that we see is some of our families are calling and saying, "What do you? I can't come to a support group. I don't have transportation. I have kids who won't be able to be, won't. We're struggling. We're trying to keep lights on, and you're talking about." Um, Get in contact with me because you want me to try this clinical trial, and we're just trying to make it through to payday, or whatever is going on. So I think that one of the things that we're doing right now, we're just granted a grant to do a storytelling campaign. Virginia, this is Sickle Cell, to raise awareness, to humanize the disease, and to promote um, access to care, like I said, in our area, which is very, very important. So that I just wanted to share a little bit about us and what we're doing, and that's my time. Thank you.
Thank you, Christina. I really appreciate you being with us. Oh, I think, yep. Hi, nice to have you, and thanks for sharing what you're up to. I want to turn the mic to Gregory. Gregory, the mic's yours.
Yeah, thanks. For one thing, Christina, I wanted to tell you how much I admire you for those efforts that you've just described. And I think there's nothing more influential for uh, people and families with sickle cell disease to tell their story, because the story is what really carries the power. But even more to follow in the example of what's happened with the cancer field or the cystic fibrosis field. It's because stories were conveyed, or stories became personal to people in positions of power. What that means is, that a senator or several senators or congressmen having loved ones who had cancer, and they feel that impact directly, and now it becomes something personal, not something abstract. That's what leads to the tipping point from just general awareness to actually a personal story with a personal impact. Cystic fibrosis, the same thing. Once somebody in a position of power has a family member with cystic fibrosis, the processes that change things, that really move the needle in the government or in the private sectors, become activated. And cystic fibrosis is a disease primarily of white people, and so it's just more likely to happen to someone in the white majority of power in Congress, the Senate, the executive elected officials' offices, and that's what really makes a difference between shifting from kind of a general awareness state to an activated state by someone who already wields the levers of power, now becoming personally affected. Things like the Cystic Fibrosis Foundation become so well funded because cystic fibrosis has affected some movers and shakers who have friends in high and wealthy places, big companies, big financial firms and so forth, and mobilizing those people in positions of wealth and political power are what really move the needle. And for obvious reasons, because sickle cell disease is predominantly associated with people of color, there aren't as many people already in positions of political power and wealth who then happen to also have been personally touched in a way that really motivates them, the way that all of you on this call are motivated. And so to make up for that, I think all of us just have to tell stories to the people in position of power so that they can hear this, and so it becomes something that they understand better. And general awareness is good, but even better is direct awareness stories provided to politicians, for example, in positions of power. And I thought last month we heard from, I can't remember if it was Georgene or someone else last month who was talking about talking directly to politicians and making personal stories and narratives heard to them, and how it actually does have an effect.
Indeed, everything that you've said, Gregory, resonates, and it is absolutely necessary to make the shifts. We're at the time in our program where we look to the future and say, okay, next time, what and who should be with us. And I'd like to give everybody an opportunity to say their piece. We'll just go around the room. Georgene, if I could start with you, I'm just going by who I see. I'll pass the mic to you for your closing comments, and also, who you'd like to have with us the next time, and if we should have a focus. Basically, the floor's open to whatever. This format is designed to be interactive and modify as everybody participates, and we'll keep making it better each time. Georgene, the mic's yours.
I would like to see next time maybe have some of the sickle cell organizations that are making a visible impact in the community, where they are recognized nationally or internationally, maybe learn about what their best practices are, how do they acquire funding, because there are a few organizations that do get the support that a lot of the sickle cell organizations are not currently receiving. And also maybe have a conversation about like the differences between like the newer the younger community-based organizations that are advocating for sickle cell, and the more seasoned veteran organizations that advocate as well, and kind of bridging the gap so that us younger organizations can learn from them, and they can learn from us as well, and we can be a greater force by working together.
Fabulous vision. Thanks, Georgene. We will definitely make it a point to invite, and I know that a number of folks were expecting to be here, but we'll continue to invite all the majors as well as the up-and-comers. Great suggestion. Next up, I see Joacy. Joacy, the mic's yours.
I agree with Georgene. I would really like to hear from other organizations who are advocating for sickle cell disease, and to learn just what they're doing more. And in addition to that, I would also like to have more researchers like me who are doing a lot of quantitative research to hear, like how Renisha and Christina are talking about different perspectives from a human perspective. So would really like to bring in more researchers so they could hear that there is this need to go more into qualitative aspects of the research as well.
Thank you so much, Joacy. And I think that is a wonderful thing to also reach in and through to any network you may have and anybody on the panel as well. And any suggestions I should mention, any suggestions for participation, if you have names or organizations specifically, if you could put those in the chat. Glynis will be picking those up and we'll make sure that we specifically make a call out to them for the next time. So thank you for that. Donna, the mic's yours.
Thank you. I think from my standpoint, one of the things that, so many great organizations are doing tremendous work, but it is a little bit in silos sometimes. And I love the idea of inviting more sickle cell groups together. And I think it might be interesting to kind of follow up on some of the policy stuff that we talked about at the beginning of the call, trying to identify what is being done and is there information that could be shared within these groups to try to push our policymakers to make sickle cell more of a priority. So I think that's my first thing. And I'm also always concerned about the mental health burden that sickle cell and what patients have to deal with. So I think, maybe looking at support services, research money towards mental health is always, a great topic. Thank you.
Thank you so much, Donna. Renisha, the mic is yours.
So I wanted to first tell Joacy, like, there are definitely a lot of quantitative mixed method research going on that address some of the social determinants of health that I addressed today, as well as pharma grants that address these too. GBT has a lot of those access grants that address those social determinants of health. So that leads me to what I would like to see. I would like us to see stakeholders in the room. I think that, I sit in a unique position. I write grants and I sit within a health system organization. And similar to what Georgene said about what's not accessible to community based organizations, sometimes it is accessible only to institutions and not in the same not provided to community-based organizations because of their fiscals or not being able to have NIH funding because they're not researchers. So with that being said, I would like to see stakeholders brought to the room, as well as I would like us to get on board with collaboration. Similar, Donna kind of took the words out of my mouth, how we can better work together, how we can empower our community-based organizations because they are our liaisons. But our health systems really do hold patients and really do, and we really are not going to make much more progress in sickle cell disease if we don't really work together and collaborate to make it better for patients.
Thank you so much, Renisha. Another great batch of recommendations. Gregory, the mic's yours.
Yeah, I've said plenty already, so I'll just suggest that you could invite someone from the Sickle Cell Partnership that has invited me to collaborate with them, but this is a group that's advocating for federal health policy changes for sickle cell disease. And this organization's found at sicklecellpartnership.org.
Fabulous. And Gregory, if there's anybody specific, if you are able to post that into the chat, Glynis will pick it up. If not, we'll reach out to their leadership as we've done with so many as we're knitting together this stakeholder group. So appreciate that suggestion. Christina, I'll give you the mic as well. There you go.
Thank you. Thank you. I don't have any suggestions at this time. This was great just being on this call, and I appreciate it. Thank you.
Oh, our pleasure. Really glad to have you. And, deep thanks to the panelists. The benefit here is these are recorded. So this is information that will travel. Really appreciate the thoughtful engagement. It's amazing how we've had a series of conversations, and as we're peeling the onion, there's just more and more that comes. I thought we might have peeled pieces of it, and then it's like, nope, there's other layers that we didn't really understand. And in this context, I think the idea is to really bring this to bear and make it known to a wider array. I want to say deep gratitude to Lauren and Glynis for their work behind the scenes to pull this dialogue together, and Julie, who wasn't able to be with us this evening. Lauren, I want to pass it back to you for a few final announcements. Lauren, the mic is yours.
Thank you. In closing, I'm Lauren. I'm an ambassador for Consuli. And here are a few announcements. In addition to this room, we also host a long COVID, data dignity, and clinical trials rooms. And you can find out more by following our club, Consuli Conversations. Just tap the little greenhouse at the top and give us a follow, and you'll be able to check out about the other rooms in our profile. You can also learn more at consuli.net and find us on social media. Our handle is at @consuli_Inc. For more direct questions, comments, feedback, you can find my email in the profile or find us on LinkedIn, and we'd love to hear from you. Be sure to follow all of our moderators, panelists, and co-hosts here today. If you or someone would be interested in being a panelist for next week's room, please reach out to us. And again, for all of you that joined and don't know about Consuli, broadly, we're a public benefit company with a mission to enable individuals to participate in the data economy. Experts suggest our individual data is worth $20,000 per year. We do this by operating a marketplace for members where we become their agent and assemble patients' health records, labs, prescriptions, wearables, quality of life surveys, and more. Importantly, members receive smart match individualized offers from us for opportunities, including to participate in clinical trials, data trials, and more. If audience members want to participate in long COVID or any clinical trials, you can sign up to be smart matched at consuli.net, and there's no cost for anyone to join our movement. And then I'll pin at the top a survey for sickle cell patients to participate in future clinical and data trials. We have a number of trials underway with our organizations, such as Pfizer, Sanquay Biosciences. So if you or someone you know is interested in participating in sickle cell clinical trials or data trials to help improve treatment options, please fill out the link survey and you'll be notified about future opportunities. So I'll add
Lauren,
that.
one quick thing I just want to jump in here briefly. Just for everybody, we are on holiday, not really, but we're dark for our Consuli conversations in August. So actually the next one will be in September. And so just FYI, that'll be something that you'll see, but just not next week. So I just wanted to make that one clarification. Thanks, Lauren.
Yes, next month or after next month it is.
September.
Yes. Well, thank you all for joining.
Thanks so much, everyone. Really good conversation. Appreciate it.